Good morning or afternoon. Today I'll be talking to you guys about a problem that's very prevalent on the streets of Portland, which is homelessness. Originally my attention getter was going to be a video. I was going to go down and film, I don't know, 2 minutes short for you guys to see what it's like to live on the streets of Portland. Unfortunately, I had to react violently after my subjects who I wanted to film tried to steal my camera and the $50 I asked. I told them that I'd pay them. I guess it was an unfair fight of sorts because they're homeless and I tend to kick ass. So, outside of that, I'm sorry that I say it like that, but it's not even funny because I feel extremely sorry for the people that I did this to, because it wasn't even fair. They don't have a place that they can go after I've ruptured a blood vessel or something of the sort. So if anything that's come from this, I've understood and appreciated the problem more. And I have a lot more respect for people who live on the streets. I myself, my mother, in the very beginning, we didn't have a house either, and we were shipping from place to place. So it's a problem that's going to be around. It's not going to be, if we stick our head in the sand about it, it doesn't just go away, okay? It's something that's an epidemic, and it's something that's very, very solvable. And as much as people don't want to have to deal with the problem, there are programs and there are plenty of people who will deal with it. Now talking about homelessness. Homelessness is very difficult to calculate because there's no way to take a consensus on people that don't have anything. They don't have social security numbers, or if they do, they don't use them. There's been no record of where they live at. It's really difficult to find these people. So what happens is that the Census Bureau or the Department of Health Services, Department of Human Services, they go down to all these places, like these the shelters and also on the streets, and do a head count. Usually they do this in March because it's between summer and it's a little bit after winter, so it's not exactly too cold, it's not exactly too hot. So most people, that's the average, and they come last year to 16,000 to 18,000 people who've experienced homelessness. So that's no joke. Why is Portland a hubbub of homelessness? We're one of the most central cities in the Northwest. We're well connected by interstate highways and freeways and railroads, not to mention also the ports that we live, the port of Portland. A little less, but you'd be surprised what comes through that place. I have a friend who works in the Coast Guard there, and it can get pretty hairy. Another reason why a lot of homeless people come here is that there's many social programs, and some of the best social programs for rehabilitation that are offered in the USA. And I'm going to address a little bit later on what they are. The causes of homelessness, there's a few factors. Each individual has their own stories, the same reason why we're all here today, why we're studying. Some of us are older, some of us are younger, but we're all here. So it's pretty much the same thing with homelessness. One person who I interviewed and did have the pleasure of not getting into a fight with was an ex-student who was 16 years old, had a 4.0 GPA, was on a national merit scholarship, and I don't know, he just had everything. And because of his addiction to methamphetamines and his inability to overcome it, he was thrown out of his house. He fought with his parents, left. Now he's lost 15 to 20 pounds, scrapes by barely on $5 a day, eats out of restaurant trash cans. Nothing that I think anybody would enjoy too much. So, now a lot of times with drugs, there's plenty of other reasons. At Homes, in this book, written by Les Whitbeck, Nowhere to Grow, they've done a lot of scientific research and talked to a lot of people who didn't have, a lot of kids who had problems at home and why they're homeless and whatnot. It says, quote, 2/3 of adolescent females and half of the adolescent males said they had felt neglected by a parent or caretaker. 12% reported they had been made to go a day without food, water, clothing, or a toilet. And over a quarter told us that they had been abandoned for at least 24 hours. Okay? causes of why parents do this and caretakers can be anything from poverty, low earnings, poor education, lack of income. So these are more socioeconomic trends rather than the stereotypical drugs and alcohol syndrome that a lot of people think. Some of you guys told me also on the Q&A board how you don't like it when a homeless person comes up and asks for change, but there's also plenty of opportunity for change for them if they seek it. Important. The programs that exist for homeless youth, there's a plan written out by the Department, by the DHS, the 10-year plan to end homelessness by the year 2015. It's written in here. I'm not going to read it to you. I'll hand it out. I'll staple it. If anybody wants to look at it, just let me know. But the institutions that provide services are as follows. There's the Multnomah County Health Department's Westside Health Center, La Clínica de Buena Salud, for Spanish speakers. We provide service to Hispanic workers and Latino workers on Burnside. Outside In, which I'll go into a little bit more detail in a minute. Central City Concerns Old Town Clinic, where if you've ever been to Old Town, there's a lot of kind of raggedy things going on down there. Some guys dealing on corners, standing outside. Nice. And the Native American Rehabilitation Association. These services are what are offered by different doctors offering community services, an example, NARA, the Native American Resource. These are all programs that are written up by the Department of Health Services and are funded by them to contribute to ending this homelessness. Now, for the youth, it's a little more difficult. The youth have a few places, more than I'd say in other areas. There's a place called New Avenues for Youth, which is actually, and Outside In, which is very close to the university. Outside In is located on Jefferson and cross streets of, I think, Taylor. Well, if you go up Taylor, north or south from Taylor, on Jefferson, you get up to Outside In. And there's also New Avenue for Youth. I don't know the street number that's on, but they also are happily providing services. Now, the adults, as you can see, the homeless adults, a lot of them go to NARA. They go to all these other places, the West Side. Families have a tendency to go to Outside In first, and then to the West Side Clinic. These outline areas is the majority of the motion of where people will go. Now, I want to talk about Outside In a little bit. For the youth, it offers numerous programs. It has a program called Virginia Woof. Has anybody heard of that? It's a dog care. Well, okay. It has a dog care program that offers homeless kids to get into an internship about, and they learn how to handle dogs. They learn how to train them, learn how to care for them. Because if you notice, a lot of homeless kids have dogs. They use it for protection. They use it for companionship. Loving partner. There's an employment resource center that works with the youth to increase work readiness, an education component that helps you obtain the GED. They can go into college. It is damn near impossible and very difficult to get an education when you don't have a place to sleep at night. You can't really do your homework when it's raining on you or there's some guy puking.